Evening, sir.
Good evening.
I'm Malago Ruben Bolanova. I'm here to do a presentation on the course clinical pharmacokinetic and pharmacotherapeutic. The seminar topic is the importance of medication adherence and strategy to improve it. Before we go into this, I would like to do a background study of this topic. Medication adherence is a stance on which the patient behavior along with medical advice, especially regarding the prescribed medication regimens. That is a behavior, the character demonstrate towards the advice of medication given to a patient when settling whatever alignment or challenges they are facing into. So this is a cornerstone of success treatment outcome. That is a powerful to a better outcome for every other challenges and disease or illness patient are facing through. So despite remarkable advance in drug delivery and therapeutic intervention, persistent challenge of non-adherence in the effectiveness of even the most sophisticated pharmacological strategy. That is even with the way for advanced technology to combat or limit non-adherence in people. There's still tendency that this adherence is something that comes up globally. Globally, study indicates that nearly 50% of patients with chronic illness do not take medication as prescribed. This statement was made by whom? That is, it's not a mere statistic. It represents a million people around the world that says that over 50% of people do not adhere or align with advice given to them with a medication. So this shows that adherence to medication, or let me say non-adherence, is a complicated issue that need to be studied, that need to be treated. In the field of clinical pharmacokinetic and pharmacotherapeutics, medication adherence holds a central position, as I said earlier, a vital or pivotal of outcome treatment. So clinical pharmacokinetic deal with how drugs absorb, distribute, metabolize, and excrete out of the body. And any disruption in medication intake can distort the process. That is, pharmacokinetic is the process starting from distribution, rising and to distribution out of the body. If there's tendency of non-adherence, there's possibility that this process will be tampered with. Let me see. If this process does not complete, there's no effective outcome of any medication. So, similarly, pharmacotherapeutic, which is concerned with clinical use of drug, prevent and treatment of disease, is rendered ineffective if patient does not adhere to the prescribed treatment protocol. So, as I've said, if pharmacokinetic and pharmacotherapeutic proceed in as much a patient doesn't align with medical advice, does not go with the prescribed protocol. Both pharmacokinetic and pharmacotherapeutic will have to work together to give us an optimized outcome. Or without or when there's presence of no adherence, both cannot work, and then there will be limited effectiveness of drug and positive outcome. So therefore, I want to go into statement of the problem of this topic. Despite advancements in pharmaceutical technology and clinical interventions, the issues of medication non-adherence remain a persistent and pervasive problem across all areas healthcare. So it has become a barrier and obstacle to effective outcome. Hopefully, I want to the healthcare at large because its main point of reduction of effectiveness, the wholesomeness of illness to some illness. That's why we are going into this topic. Also, the problem is not isolated to specific regions of disease. It is transit demographic. That means in old age, old, young. This non-adherence has been something that common to everybody. Also, affecting patients in both developed and developing countries, and particularly critical and chronic diseases, both developed and underdeveloped countries also experience non-adherence in medication. So non-adherence can render even the most potent therapeutic ineffective. That is, if the patient does not continue or decline in treatment, the potential of the drug will not be exerted on any illness or disease. Therefore, I want to go into the key definition or let's just say definition of key terms, which is medication adherence, non-adherence, compliance, persistence, pharmacokinetic, pharmacotherapeutic, therapeutic drug monitoring, direct adherence measurement, indirect adherence measurement. Therefore, I'm going to start with medication adherence, the degree of which agent medication taken, behavior corresponding with accurate recommendation from the healthcare provider given, the level at which a patient align accurately with the protocols to the guidelines in which the health provider has given concerning a particular medicine to be used. Non-adherence, failure to take medication as prescribed, failure to comply, to agree to the way in which what the advice in which health profession has given concerning a particular drug, and the compliance is often used interchangeably with adherence, but implies a more passive proof by the patient, following the provider instruction without active engagement. So we are trying to bring out compliance different from adherence, but both are used interchangeably. But compliance is that the ability of a patient to imply or comply more passively to the rule, that is checking of the drug. As we are going into persistence, the duration of time the patient continue to take the prescribed medication irrespective of correctness in dose. Persistence is something that will begin to come continuously, no interruption. Persistence continuously in the way implement to the advice guidelines for a certain drug. Also, we are moving to pharmacokinetic, a branch of pharmacology concerned with the movement of drug within the body. That is starting from the process of ingesting drug into the body, absorbing, distributing metabolism, and finally expression out of the body. It starts from taking into the body, absorbed, distribute, metabolized by the liver, and then expressed out. Therapeutic application of drug prevention and treatment. Therapeutic simply means treatment and prevention. Treatment and prevention. Now, therapeutic drug monitoring, a clinic practice of measuring specific drug level to maintain a constant concentration in patient bloodstream. Therapeutic drug monitoring. There's no way every drug has a concentration that needs set on movement and effectiveness in the body. So, therapeutic drug monitoring this expects a measurement of a certain concentration of a particular drug in the body. Then, we have different adherence measurement method used as blood, urine test that provide physical evidence of medication intake, direct adherence measure can measure if someone takes drugs have been complying or adherence to a particular drug. The evidence in get evidence if this person is really taking drug, you can get evidence in the blood because the concentration of this will be present in the blood as well in the urine. If you take if you are maybe just like about dictating if someone has a particular people or use a forensic stuff. So now indirect adherence measurements, self-reporting, pill count, electronic monitoring used to require adherence behavior like how many drugs do you have, how many drugs have you been given, how many your reports. You can use that report out through electronic report about drug that is being given out. Now we are moving into chapter 2, concept of medication adherence, which is definition and dimension of medication adherence. Medication adherence is more than just following doctor's order. It's more than just following doctor's rule about a certain drug. It represents the alignment of patient action with prescription medication regimen, meaning alignment of your behavior towards this particular drug, alignment of the concept of your thinking, your cultural, economic, and so this reflecting their understanding, belief, and trust in treatment process. According to medication adherence is the degree to which a patient behavior corresponds with the agreed recommendation from a healthcare provider. This definition emphasizes shared decision making, moving beyond the outdated paternalistic concept of obedience. So the concept of adherence is multidimensional, which involving initiation, implementation, and discontinuation. Now, if you are aware, I will say initiation refers to the first dose, that we take in. That initiation is initially mostly the first dose, and then we move into implementation. This denotes how closely the patient follow the prescription dose dosing schedule and how we are following the guidelines, consistency and persistence, and now we move into discontinuation, which is withdrawal. Dimension of medication adherence, initially implementation, initially first dose, implementation, continuation of the first dose, and then discontinuation, which is withdrawal from adherence. Adherence is influenced by five broad categories of factors, often referred to as the Wu five dimension of adherence. Firstly is socio-economic factor, which can come in other way like income, education, employment, cultural belief, and as well as healthcare system factor, provider-patient relationship, accessibility to medicals, and qualities of care. So the other dimension is condition related to the factor that is disease, severity, symptoms, comorbidity, that is a patient can be dealing with two, three different illnesses at the same time. So it's another dimension of no adherence. Now, type of adherence. Here we are giving primary adherence versus secondary adherence, and also intentional adherence and unintentional adherence. Now, primary no adherence occur when the patient fails to pick up a prescription, as given, but yet you do not go to take it. That the failure if to take a step concerning your illness. The second one is secondary, which is implementation. You might have already collected your prescription, but yet you didn't follow. You didn't follow to go continuously following the procedure of taking your drug. Or even you're getting the medication, you skip in the dose, taking the drug in correctly interval. You have say 8 hours, and you're taking some after 8 hours, you change to 5 hours after the first 8 hours, because you have to go into this dose and 8 hours, or you are interchanging the time, maybe due to implement or the work the person has been going to. He overlaps on the duration of the drug. Now, another category distinguishes between intentional and unintentional. Intentional non-adherence is a consciousness, a decision, a willingness to discontinue a drug. This can come in a place like when a patient seems to see effectiveness of a drug, but yet complete the surface of the drug. Taking, for instance, the case of anti-malaria drug, you are to use the drug for 3 days, but take the first day, second day, now you feel relief. You intentionally drop out. Anti-malaria support, no matter how the positive outcome you've been seeing, the cycle supposed to complete. Now, the unintentional non-adherence, this comes with forgetfulness. Non-intentional forgetfulness, or understanding instruction and guidelines of the drug. Now, importance of adherence in pharmacotherapy. Adherence is an effective pharmacotherapy. Even the most well-researched and potent drug will fail if not taken correctly. In diseases like hypertension, where symptoms may not be immediately apparent, poor adherence can quickly lead to several consequences, such as stroke or kidney failure. From pharmacotherapeutic perspective, resistant drug levels are critical. Missed dose lead to subtherapeutic level, which can reduce efficacy, while overuse can cause toxicity. From chronic diseases like HIV/AIDS and tuberculosis, missed dose can result in drug resistance. Now, no adherence cause and consequences. No adherence does not always stem from carelessness. People live within a complex reality. For instance, a mother managing children may forget her insulin dose. A retired might skip hypertension pill due to pension constraints. That being an economic factor. A teenager with depressed may not believe the medication will help if it. Now, clinical pharmacokinetic and its relevance to medication adherence. We are talking about absorption, preservation, and metabolism and excretion. Each of these steps affects concentrations of drug in bloodstream, which in turn determine the drug therapeutic efficacy or toxicity. Pharmacokinetics is not a theoretical science confined to laboratory alone. It plays a vital role in personalized medicine, helping clinicians choose the right tools in the right drug in the right dose and at the right time for the right patient. S for right, the right drug the right tools at the right time, and then for the right agent. It becomes especially crucial in patients with renal or hepatic impairment, the elderly, pediatric population, and those on multiple medication. Uh,
Conclude.
Now, I still want to emphasize on the fact that affecting medication. The group are five: patient-related factor, therapy-related factor, condition-related factor, healthcare system-related factor, socio-economic-related factor. Now, patient-related factor, cognitive function, and health literacy. This shows the level of knowledge of patients concerning a particular drugs. If they have limited knowledge of a drug, the, it is the right of health provider to empower them, enlighten them about a certain drug which they are giving to them. Belief also to belief under patient-related factor, their belief, perception, and attitude. What they believe and what they think about a certain drug will be different from what the other person drink and how the healthcare provider also think about that drug. Now, motivation and psychological state. Psychological conditions such as depression, anxiety, or stress can impair judgment, motivation, and memory. Now, under therapy-related drug, complexity of drug management. Situation whereby we have a lot, let's say polypharmacy. This can become a therapy-related factor, making it complex, making it difficult for a patient to adhere to the instruction given to them by healthcare provider. Also, another one is side effects and tolerability. Adverse drug reaction are major cause of non-adherence. Common complaints include gastrointestinal discomfort, drowsiness or dizziness, vertigo, sexual dysfunction, skin rashes. Some reason why other people may decline or no to not adhere to a certain treatment. The reason they give, they have discomfort in their stomach, they are drowsing, their sexual performance downgrading. It may be a reason why they withdraw from a certain drug. Also, the duration of therapy. Adherence often decline over time. For instance, antibiotics are often stopped prematurely once symptoms resolve, leading to incomplete eradication of pathogen. Bacteria and antibiotics sometimes they, they decline in their potency of effectiveness, which may lead to a withdrawal. Now,
Your time is up.
but people want to go to consequences of non adherence to medication. Firstly, disease progress and complication. It reduces therapeutic effect, efficacy, antimicrobial resistance, economic, under that we have another one, economic consequences, increased healthcare cost when when people does not take drugs according to the way they're supposed to take it. The production of it sometimes it will be high demanding, and when things are high demanding, the way the other companies or the production of it will be some kind of difficult or something complex. And the way some companies always find a way around it. And when they find a way around it, they increase the cost. Something that they usually get people or it has come in high demand. Maybe they used to get the drug in about 6 months. Now it come in high demand in within 2 months. They have to find another way. Maybe they find increasing the duration, and if you increase the duration of production, there are some things that you sacrifice, and if in the process you have to include all those things, leading to high cost of the production. Go to the
Conclude. 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 Your time is up.
productive use and work. Abstinence.
Conclude. Conclusion. Your time is up.
Conclusion. Improving medication adherence is not a one-size fits all that. It requires layered, individual, and holistic strategy that address the biological, behavioral, and social and economic dimensions of human's life. From busy urban professional to rural elderly grandmother, adherence solution must be accessible, empathic, empathic and sustainable. Medication adherence remain a linchpin, remain a vital process in pharmacotherapeutic. The missing link between prescription and outcome. That's what we call non-adherence. The missing link from prescription and outcome. In theory, the most effective medication cannot help a patient who never takes it, and in practice, optimal adherence undermine even the best pharmacological advancement. The conclusion is unequivocal: without adherence, medication is potentially unrealized. It is therefore imperative that adherence be treated not as an afterthought but a clinical priority. Thank you.
Thank you very much. Thank you very much. God bless you. Thank you very much for this wonderful presentation. Thank you. Please next time try to increase your voice, your volume, so that people can hear you. Those on with us are complaining that they cannot hear you clearly. Please in the next presentation, please increase your volume so you can be heard clearly. All right. Can you hear me now? If you can hear me clearly now, please raise your hand. Let me. If you can hear me clearly now, raise your hand because I want to know where this thing is coming from. Can you hear me clearly? If you can, raise your hand. Good. All right. Can you still hear me clearly? Raise your hand. Can you hear me clearly? Raise your hand. Can you hear me clearly? Raise your hand. Please, if you can hear me, comment. Can you hear me? Please comment.
Okay, that's it.
All right. So we will go to the next in few minutes time. We'll come back maybe around 5:30. Sorry, 5:35. Come back for the next topic. 5:35. Join us for the next topic. All right.